If you like the video, subscribe the channel, press the bell button, getting more videos.
Hi viewers, today video is about postural hypotension. What is postural hypotension or orthostatic hypotension? You are getting low BP. Normally our body will having 120 by 80 millimeter of mercury, that is a normal BP for a human being. But in case of spinal cord injury, you are having a low BP. It can happen in two ways. Because you are a paraplegic, you have less chance of getting low hypertension. But on the other hand, if you are a quadriplegic, your neck was injured, below your neck you have been paralyzed, there is a more chance you people have to get postural hypotension. Why it is happening? If the blood is coming down, can become due to gravity. But if has to go up, the venous return has to go up means the peripheral muscle have to work on. If the peripheral muscle, that is calf muscles or your leg muscle, is not contracting, so that the blood flow is not maintained. So when you are changing the position from lying to sitting or sitting to standing, if your leg muscles is not working, that time you will having this symptom that is called postural hypertension. Technically you say postural hypotension, that's right, but what the patient will say, if you make him sit or make him stand, the patient will have giddiness. Giddiness means they suddenly go for syncope, their eyes will be closing or they will become unresponsive. Sometimes they may say they can't see anything, there will be blackouts, the blurred vision and giddiness, sudden unconscious. These are all the symptoms which can be observed and patient can tell you. But if you go with stockings, compression stockings, or ask them to take some oral drugs or salt used lemon juices, and you can ask them to drink mutton milk, those kinds of diet and drugs along with stockings, you can prevent postural hypertension. Hi viewers, last video what we saw was postural hypotension or orthostatic hypotension. What will be the signs? This part shows about management. That is, even though you use stockings, sometimes patient will have giddiness when they are propelling to a erect position. That is from lying to sitting or from lying to standing. So what is the treatment for that? If you found patient is having this kind of postural hypotension, one way is to find out is checking the BP. What is a normal lying BP and what is a BP when they are sitting or standing? If it is suddenly drop, the management is you put them down. You have to put the legs or the posture of the patient has to be in a lying position. So make it flat as soon as possible, and the next moments what you have to do is loosen the straps. In between you have to check what is the status of the patient, whether they are conscious or semi-conscious. You just talk with them, you found out how they are feeling, whether still that blackness or lightheadedness or feeling is there. If they resolved, what you can do is you can just make them rest for some time. If still the signs is there, you can do two things. One is range of motion exercises, so that you can increase the circulation. If the blood circulation is increased, so the heart is getting more blood. So by lower, there is no active muscle pumps, by doing passive movements you can increase the blood flow. By that you can increase the BP, so that it will reduce the postural hypotension. On the other hand, you can use other technique, that is called elevating the limb. Elevating the limb by using pillows or just by your hands. The elevation should be how much? That should be above your heart level. That should be above the heart level, and by lifting your head you could see the legs. That height you have to lift, so that the venous return will again increase. By that the patient will improve from the postural hypotension. Okay, so management part is gradually increasing. You have to increase from 0 degree to 20 degree, 30 degree, 50 degree, 70 degree, 90 degree, like that. Progression, it can be in a sitting position or in the lying position. First thing is you have to put them on a progressive manner of a tilting, either in the bed or in the wheelchair. On the other hand, if the patient suddenly complains when they are sitting, what you have to do, you have to do the same thing, just put them down. If needed, like other table shows, you lift up the legs and do range of motions or increase the venous return exercises. Use compression stockings, progressively increase the degree of tolerances. That is, from the horizontal to vertical position, you have to properly do it in a slow manner. Don't do it abruptly